So this is a very interesting question for today. So a patient was diagnosed with PNH, paroxysmal nocturnal hemoglobinuria. The patient was treated with a drug called eculizumab. To what kind of infections are these patients more prone to? Okay, so the patient is having PNH, so you should understand what is PNH. So it's the only hemolytic anemia due to an acquired defect in your RBC membrane. So what happens? Your RBC membrane has got a lot of proteins. You have a group of proteins called GPI linked proteins. This disease is due to mutation in a gene called PIGA gene, phosphatidyl inositol A gene, which leads to deficient GPI anchor. So what are these GPI linked proteins? You have a lot of GPI linked proteins. So some of which are defective in PNH are CD55, CD59 or membrane in or C8 binding protein. Okay, so the CD55 is otherwise called decay accelerating factor. CD59 is called membrane inhibitor of reactive lysis and C8 binding protein. So these are all going to control your complement activation. When you have mutation in these genes and defective GPI linked proteins, what happens? There is unchecked activation of your complements. Okay, so because of which you can develop a lot of complications. So basically there is unchecked activation of complement. So when you go back to your general pathology, you would have learnt about complements. You have different complements numbered from C1 to C9. You have different pathways of activation, your classical pathway, alternate pathway, and your lectin mediated pathway. So remember, alternate pathway A4A is activated by IgA, whereas your classical pathway is activated by IgG and IgM. Whatever it is, your end product is formation of something called MAC or membrane attack complex, which is formed by complement C5 to C9. So I told in PNH there is unchecked activation of complement resulting in formation of MAC. So how can you treat it? You have to inhibit this complement or this MAC. So how can you inhibit it? Only if C5 is there, you have formation of MAC. So you give a drug antibody against complement 5, which is nothing but eculizumab. So it's like a double-edged sword. You have to control your excess complement activation, but what happens, this complement are the one which is going to help your body against defense mechanism like infection by certain organism. So when you're going to inhibit this complement, you're more prone to develop certain infections, especially these complements C5 to C8 we call late complements. So when you have deficiency of late complements, the patients are more prone to infection by Neisseria and toxoplasmosis. Whereas when you have early complement deficiency, what happens, you can have something called SLE like picture. So what about other options? Atypical mycobacteria, if you remember, which infection, like which disease, patients with which disease are more prone for this infection? I have already put a video on this one, hairy cell leukemia, because you have monocytopenia. So what happens in candidal infection? Whenever you have neutropenia, you can get candida infection. We call it as febrile neutropenia. Epstein-Barr virus, it can cause many infections, but to quote a specific infection in immunodeficiency, you have something called X-linked lymphoproliferative syndrome, which is due to mutation in a protein called SAP, which is called SLAM associated protein. This protein is involved in various signaling of your lymphocytes, T cells, B cells, and NK cells. So when you have defect in this protein, certain organism like EBV can't be killed and they can develop a lot of infection and sometimes malignancy by Epstein-Barr virus. Okay, so this is about these infections. So other immunodeficiencies I have discussed. Hyper IgM, the patient is more prone to develop infection by Pneumocystis carinii pneumoniae. Then your Bruton's A gamma globulinemia, they can develop infections by Giardia. Like that, for each immunodeficiency you have certain infection to which the patient is more prone to develop. Okay, so I'll be posting more interesting videos like this. So if you are more interested in learning clinical based scenarios, you can subscribe to the channel. Thank you.